If you are from African ethnicity and are looking out for a hair transplant for yourself, but you have gone to many clinics and you have not got a clarity what is the difference technically in a hair transplant being performed in a patient with your ethnicity, then this video is made out for you. In this video, we are going to discuss 7 important points which you should be knowing if you are from African ethnicity and want to know how the hair transplant in this subgroup is different from a hair transplant which other people have. Please keep on watching this video till the end because we are going to discuss these points one by one and they are very important for you. My friends, I am Dr. Satya Saraswat. I am an American board certified hair transplant surgeon, a member of International Society of Hair Restoration Surgery and various other organizations, and I am a gold medalist plastic surgeon in this field of hair restoration since 2006. Have done many hair transplants, treated many patients of hair loss, and have trained around more than 90 doctors in the field of hair transplant itself. Please subscribe to our channel if you want to know more of such informative videos. Now coming to the first point, jumping straight to it, the first most important point which you have to technically consider in your case is that there is an excessive curl in patients with African ethnicity. You can see this picture on the screen to know what curl in a follicular unit looks like. This curl can continue from top to bottom and maybe a continuous curve. There are special punches to decrease the chances of these curves. There are U-graft punches and various other punches, hybrid punches, which decrease the chances of damage or transition in these cases who have this excessive curls. Also, there are special techniques like J or U maneuver, which you can again see on the screen how we can prevent damage to the curly hairs and get intact beautiful follicular units by following these principles. As you can see, there is a row of follicular units being shown on the screen here where you can see a lot of grafts being harvested in a patient of African ethnicity without damaging these follicular units. Please give a thumbs up or a like to this video to boost our confidence in making more such kind of videos for you. Second important point is known as splay. Splay is the divergence of the hairs or follicles inside the skin surface when we take out the grafts or we are harvesting these grafts by FUE method. And this is important to know because if we do not know about this, then there may be a higher damage rate in these kind of patients. We will show you on the board what all means, what is a curve and what is a splay, what are the different kind of follicular units which we see in our practice. Please remember that patients' hairs are coming out like this. They are not like this. So these hairs are always going towards the nape of the neck, and the patient while extraction is mostly lying his face down on the OT table. Different FUE scenarios which we are discussing here is this is a straight or a tubular follicular unit. This is a 2-hair follicular unit. This is the skin. These black are the hairs. This is the neurovascular bundle or the nerves which are supplying the blood to the follicular unit. This blue is depicted as the muscle, erector pili muscle, and this green is the sebaceous gland, just for the depiction purposes. So this is a straight or a tubular follicular unit, and a simple, in our terms, it's a very simple follicular unit to extract. These are 2 follicular units very near, technically difficult because we may transact one of them, but this is not the focus of discussion here. This is very important for you to understand what is splay, which we have discussed. Splay is that this is a 3-hair follicular unit with splay, which means inside the hairs are diverging. They are not coming out like this, they are diverging like this. You can see another follicular unit on the screen also where these hairs are going away from each other. So this is difficult. If the punch goes like this can damage few of the hairs in a particular follicular unit. So this is important to know in a African ethnicity. And this is another 3-hair follicular unit without a splay. Now this is the curl which we were talking, which is again very important for you to understand. This is the curl which we are talking about. Here the follicular unit is curling inside. If we just put a punch like this, you can see that this is going to damage the hairs. So this needs the J maneuver or the U maneuver. So this has been described in literature. we have to move the punch in this particular direction to prevent the damage or the transaction of these hairs. So these are the few important points which you have to understand. Please write down in the comment section below if you have had an experience of hair transplant with the curly hairs, or you are looking out for a hair transplant in a curly hair patient. Coming to point number 3, after the curl or the curve and splay, is the density. The density in African ethnicity is on the lower side when we compare this density with Caucasian or other subsection or other ethnicity. The density in African ethnicity is around 60 to 70 follicular units per centimeter square in the donor side, whereas in Caucasian population we see much higher densities of follicular, around 80 to 90 follicular units per centimeter square. Point number 4 is the caliber or the thickness of hairs. The African hairs are slightly thinner. Generally, on an average, they are between 60 to 65 microns, and in general, this thickness or the width of the hairs in Caucasian and other subsections or groups is around 70 to 75 microns. So the thickness is also less and the density is also less. The fifth point which you have to know and understand, that the results of a hair transplant depend on the contrast between the color of the hairs or the follicular units and the underlying skin. If this contrast is high, suppose a patient who is fair colored person and he has black hairs, or if there is a darker individual with gray hairs or white hairs, then the volume of the hairs will appear to be less. Whereas in African individuals with a black hair, they have very less contrast between the underlying skin and color of the follicular unit or the hair. So this less contrast means that even if we are transplanting grafts of follicular units at slightly lower density, still it gives a good coverage. What it means is, in general, we try to achieve a density of around 40 follicular units per centimeter square, at least in the front hairline, which is a very decent density in terms of hair transplant. But in African ethnicity, we can achieve almost the similar kind of volume because of the lesser contrast between the color of the hairs and the skin by giving a density of 30 to 35 follicular units per centimeter square. So even if number of grafts are lesser in the donor side, they are thinner, still it gives a pretty good coverage even with a lower density. So this is an additional beneficial point in African ethnicity. If you also belong to the same ethnicity and are looking out for a hair transplant for yourself, you can call us at the numbers given below and we will try to reach out to you. We will try to solve your problem or guide you about your hair transplant. You can also send your pictures directly on WhatsApp, then also we will try to help you out. We have an app by the name of Saraswat Hospital App which predicts the kind of results you can expect after the hair transplant. So the link to that app is also given in the description below. Point number 6 which you should be knowing is the higher chances of keloid in darker patient, not just African but anybody who is darker skin tone, skin color, they have higher chances of keloid. What is keloid? It is excessive skin formation or scar formation after an injury. If you have a keloidal tendency, then undergoing a procedure by FUT is definitely not a good choice. Although the chances of keloid are there after FUE hair transplant also, but the chances are lesser than FUT. To know whether you have this tendency, kindly look out for the sites where you got a vaccination done, like here on the arms, or if you have got any injuries, you see if there is a thick scar tissue over there, and if you have that thing, you have to be very cautious and you have to discuss this point with your hair transplant doctor that you have a keloidal or a hypertrophic scar tendency, and discussing this with your doctor is going to help in decision making about the method you have to use and to prevent formation of these keloids by doing various methods which are available, but still it is a risk with every hair transplant. If you want to watch one of our hair transplant in an African patient, please click on the video given in the link above. The last point which I have to discuss here is the hairline, which is different. In Caucasian or other populations, there is a frontotemporal angle, which means that the hairline curves like this here and here. So whenever you are going for your hair transplant, please do take your pictures from your times when you did not have that significant hair loss, because in general the African population has a slightly straighter hairline. It's different from the other subsection or the other groups. So please do take some pictures, your previous pictures, and discuss this hairline factor with your hair transplant doctor. Also, in general, the African population, they keep their hairs on the shorter side. So if you have a shorter hairstyle, you keep your hair short, then you should avoid FUT, because it is going to lead to a linear scar at the back and going to be very, very visible. So these are 7 important points which you have to remember before planning your hair transplant. If you are planning a hair transplant for yourself or your family members or anybody you know, then do share this important useful video with a lot of tips in it, so that they also have this knowledge and can consciously discuss many of these points with their treating doctor. Please click the video on the left to see one of our recent hair transplant patient, and please click the video on the right to know more about scalp micropigmentation. Thank you.